We begin with a new report this week showing that Long Island's public drinking waters have the highest concentrations of a suspected cancer-causing chemical that's being widely used in everyday manufacturing. TV 1055's Jennifer McLogan explains this potentially hidden danger.
We're married 69 years in March.
Rita and Anthony Kirsch raise a glass to their health, to their children and grandchildren. The Kirsches live across the street from the Hicksville Water District site.
I told them they better keep giving us clear water or I won't pay my bill.
Homeowners here feel vulnerable, now learning that the man-made chemical 1,4-dioxane, a probable human carcinogen, scored the highest hit in the entire nation, 33 parts per billion, in a Hicksville water well, now used for emergency purposes only. And according to an environmental study released just hours ago, Hicksville is not alone. Multiple other Long Island communities tested for unsafe levels of the manufacturing solvent, widely used in consumer products such as detergents and shampoos, draining and leaching into Long Island's aquifers.
Our sewage and septic treatment systems are not designed to filter out 1,4-dioxane, which is how the contaminant ends up in drinking and surface water.
Citizens Campaign for the Environment says 1,4-dioxane must be attacked vigorously with mandated testing, required labeling, removal from personal care products, and from laundromat discharge. Treatment must be funded. The Suffolk County Water Authority will start a pilot removal system in April.
If nothing is done now, this problem will in fact get worse, and it will continue to be a public health threat.
Citizens Campaign will now be tracking the wells, releasing an interactive online map marking water contamination hotspots.
That will seep into the ground and hurt our water supply.
The governor and others in Albany say this is a national issue and the federal government needs to step up and provide clear guidance to states on how to deal with 1,4-dioxane. From Bethpage, Jennifer McLogan, TV 1055.
And here to talk about this more is Jordan Christensen. She is the program coordinator for the Citizens Campaign for the Environment. And welcome to the show, Jordan.
Thanks for having me.
So how serious of a threat are we talking about?
So this emerging contaminant is in a lot of the public water supplies throughout Nassau and Suffolk County, in some of them staggeringly high amounts.
Give us some examples.
We actually studied the public water supply across Long Island, and we found that over 2 million people, or about 75% of the Long Island population, drinking from wells that have 1,4-dioxane levels over our EPA's cancer risk guideline of 0.35 parts per billion.
You know, nobody ever heard of this till perhaps this past year. I know environmentalists have certainly been aware of it, public water companies, and there's been an ongoing debate, but this is, for most people, the first time they ever realized this was happening. What is the evidence that it causes cancer? Why are we calling it a probable cancer-causing chemical? Don't we know?
No, so the EPA listed as a likely human carcinogen. And you're right, many people haven't heard about this until the last year or so. It's what's known as an emerging contaminant. So it's still being studied, but initial health reports find that it can lead to tumors of the nasal passages, liver, gallbladder, a myriad of public health impacts.
Well, that's alarming, and that's from your drinking water. Or if you even don't drink the water and you filter it, maybe you're cooking with it, or you're showering in it, or bathing in it. And so there's absorption at any level. So who's using this chemical, and why are they using it? What for?
So it's actually just a byproduct in the manufacturing of a lot of our personal care products. It isn't intentionally added, and it can actually be pretty simply and inexpensively removed. But unfortunately, many manufacturers are choosing not to do that.
Well, we'll talk about that in a minute, but, you know, I saw that it was used as a solvent. Isn't that used to dissolve things in highly caustic chemicals?
Yeah, it's used, you know,
so that's shocking to hear that, that one of its main purposes is to be a solvent. So when they're mixing chemicals, that's one of its purposes?
Right, yeah, it can be as a solvent. We can find it in inks, varnishes, all sorts of sort of caustic chemicals, as well as things like detergents, dish soap, shampoos, cosmetics.
Well, you know, you say that, you know, 1,4-dioxane, right?
Yes, 1,4-dioxane.
Taking a while to get that down. And I didn't see it on any labels, though, yet you say it's in all these products. I'm searching toothpaste, hand lotions, shampoos, everything I can look at in my bathroom, in my medicine cabinet. I didn't see it anywhere.
Right. It's one of the biggest hurdles is because it's only a byproduct, it's not listed on any labels. So
there's no requirement for that? I thought when I read the labels on something, I was seeing exactly what's being put in there. That's not so? No,
we're actually calling for federal labeling on it so people can make, you know, informed decisions. But for now, it's pretty difficult. For consumers, one of the things you can do is look for ETHS as one of the ingredients, things like polyethylene, sodium lauryl sulfite. Those usually have dioxane, but again, you don't want to be reading 30 different shampoos
And it's all
every
listed
time.
on your website, right, that people could see these other names that
Right.
are common. Because when you look, then you see some of those names, and there it is.
Right.
So then the manufacturers must somehow believe that it's safe. They've been using this stuff for decades now.
Well, so it has been in use for decades, but unfortunately, there's only been sort of recent calls to action on it. So right now, the FDA actually recommends that these manufacturers remove it. Many of them are choosing not
Really?
to. So there is a big push on the federal level, and we need our senators and Congress people
Okay,
as
so
well.
then what is this easy, cheaper method? Because, you know, cost is always a factor. If now every medicine and health product we use is going to cost twice as much to get rid of this, there are always going to be people say it's not worth the cost. What are we talking about here as far as an expense for removing it?
Well, according to the FDA, they list it as simple and inexpensive. So
Well, what
this
does that
isn't
mean,
a
though? What do they actually have to do?
I'm not sure what you know, it's within the manufacturing process. Some of them are doing it, some aren't, but it doesn't add a huge cost. And the truth is, for a chemical that's going to be causing, you know, decades of legacy contamination in our drinking water, we should definitely be doing that.
I would
It's
think
inexpensive.
that they'd already be thinking about alternatives, are they? Considering the uproar that has occurred here, especially in our area.
Right. It isn't really, I don't think, a matter of alternatives. It's just a matter of removing it during the process. It's just adding a small extra step.
Well, could the
with
water
chemical
districts do this then?
So that's what we're pushing for as well. We're working for New York State to create a health standard so that we know what to treat down to. And once that happens, Suffolk County Water Authority is currently piloting sort of a state-of-the-art water filtration system that we think can get it down.
And here we see the map, and you see all the hot spots. Explain what this map shows. It comes from your organization. And this is based on what, so we know whether it's accurate or not?
Sure. So between 2013 and 2015, our public water suppliers all gave data to the EPA on 1,4-dioxane levels. We compiled it onto this map. So those red dots that you see, those are water districts that had wells that tested over the cancer risk guideline.
Which is what percent? Or what?
0.35 parts per billion.
0.35, and you were getting as high as 33 parts?
So one in Hicksville had 33 parts. That well's been shut down. But in Western Nassau, we're still seeing 8, 10, 12 parts per billion.
But since there's no regulation on this, it goes to what they call the EPA default parts per billion. Has to be, what, 50 parts per billion before they get alarmed? Well, you're asking for well over 100% reduction there from that number. I mean, even to get it to 33, you get from 33 to 0.35, that's a 99% reduction. Can they really get rid of that much of it?
Yes, actually other states have risk guidelines right around that 0.35 parts per billion mark. So New Jersey, Massachusetts, Colorado are already doing this. And Suffolk County's tests seem to be going well for their
Well, would it be a
filtration
big
system.
expense for the Suffolk County water authorities and other people that are worried about this? Because I heard I saw a quote by one of them saying, well, we'll spend some money on it, but we don't know exactly what this could cost to contain it.
Sure, and they're still piloting the filtration system, but from our point of view, this is such a big public health threat, and it's emerging. It's worth the cost regardless, and of course, we would need state and,
So where does this stand right now? You're demanding the EPA really severely restrict the use of this chemical and set a very low standard for it being detected. We have a new administration. Have you already requested this from the EPA? Is anybody requesting it from the EPA?
Yeah, so actually both of our state senators have already written letters, as has Governor Cuomo. Governor Cuomo has also said that if the EPA doesn't put in their health-based drinking standard in a timely manner, New York State is going to move forward.
Well, sounds like a political battle shaping up there. Jordan Christensen with the Citizens Campaign for the Environment. We'll be watching what happens. Thanks for the update.
Thank you.
And up